This is a really timely topic. If anything, we may have started these conversations a little too late. We're all aging, right? This isn't a conversation about somebody else. This is a conversation about us. We're all going to care for somebody at some point. Chances are somebody's going to end up caring for us. We're looking at as many as 150,000 people by the year 2025, more than double the number of folks that we have right now who will be not only elderly but in need of some kind of supportive service.
The aging community in Appalachia, it's in a rural setting, so the conveniences that you might find in an urban setting, it's not there. There's lack of public transportation, and a lot of the conveniences that you can get to quickly, you can't get to in rural America.
Aging in place at home is really important as a solution to this. The quality of life for folks is they would choose to be at home. They are happier at home. That is where their community and their families are. And that gives folks the dignity and grace, I think, when we talk about aging gracefully. Right now, Fahe is assisting approximately 500 households a year of people who are over the age of 65. Where we know that we're falling short is we're not connecting to the necessary services it takes for people to age in place. That means they're just one incident away from needing to be moved to some type of supportive system.
And when you go into a facility, in essence, you give up your independence, because most of the facilities that are not private pay are nursing home facilities.
I think the other thing that really stands in our way is that, all things being equal, the aging population in Appalachia tends to be poorer by about 35% compared to the same age households elsewhere in the country. Our folks' ability to pay for services just don't quite exist the same way.
But there's always that point where you can only do so much. And if you're a housing provider, you can make sure that there's a ramp, that the house is handicap accessible. But when your work is done and you leave, you don't know what happens after that.
As a network organization, we get to be involved frequently in conversations that often need just leadership. And to date, that's really what we have to offer here, is that we have some boots on the ground across the region. We're seeing things firsthand, and we're also seeing a lack of conversation between, I think, the necessary parties. So we may not be the ideal folks to lead this conversation. Right now, we're the only folks making that attempt.
We're all thinking about the needs. We just haven't figured out how to do it by ourselves. So Fahe can bring the groups together. We can talk, we can plan, we can start to think about what things need to be done differently in our region to address the needs, whether it's from a policy change to just linking the housing specialists with the service providers together. But that's what Fahe does as we move forward in trying to figure out how to help the aging population age gracefully and improve their quality of life.